It came from meeting with departments. It came from listening to individuals when we spoke with them. It came from our leadership forum. It came from the small groups at the leadership forum. There was a consistent message that was being delivered to us that we were missing out on an opportunity to create a neutral place for people to go have a chat about a variety of different things that may or may not lead them to want to pursue in a different direction. So a professional office that could give advice, consult, even help in various situations before it turned into something more formal, if you will.
It was around May 2020. So COVID was well and truly up and running. We were dealing with a lot of pressures in the organization around COVID, capacity management, staff being ill, adequate staffing, and all of the concerns that healthcare was facing. At the same time, there were considerable concerns as to how people were feeling, how they were responding, how they could continue to work in an environment, and what resources did we have available to support them. And we, at the time, we still have a number of resources that help from the physician side, clinician side, HR, but they tended to be a little bit fragmented, and they had specific areas of themes and focus. And Dick Argus, our Chief Culture Officer, and Dr. Sarah Toomey, who's a Chief Wellness Officer, Experience Officer, brought to us this concept that we should have an ombudsperson. It's an organizational approach to improve the culture of the organization to start with, but it's a means by which people can really get to what I recall the four main components: something that was informal, something that was independent, something that was impartial and confidential. It was a safe place for anybody in the organization to go to. And that just made sense. And it was the right thing to do. And so we started that process around May of 2020. And within 12 months, had not only formulated what the role would be, but also selected our ombudsperson in Jen Marnie, who's just been superb.
So our Ombuds program adds incredible value to Boston Children's Hospital. What it's developed and how it's developed has been an incredible resource for not just staff, for faculty, for all parts of the organization, to be able to have a place for difficult questions, for difficult conversations. And it's not just they're able to ask those questions, but they get resourced. They get support in getting the questions answered. They get a resource in those difficult relationships, those difficult encounters. How do I manage this? How should I deal with this? So the expertise that's brought to bear has just been phenomenal. I think has really taken us to a next level in terms of our staff physician engagement.
So I was really a novice. I had heard about the role of an ombuds. I'd heard about organizations that have ombuds practices and programs, but I really was not deeply familiar with it. And so I didn't quite know what to expect, and I would even maybe put myself in the skeptic column a little bit. Was this going to be another redundancy? Would this truly do something, accomplish something different than what we had before? And would it be confusing for our organization? Who do you go to for what? And I have to tell you, it has been, for me, one of the most important changes that we brought into the organization in the last couple of years at a time of great organizational strain. Coming out of COVID, the world being in various layers of chaos, if you will, at times, or at least also with strains. And what I've really come to experience is that the clarity of the mission as it was outlined, the clarity of the role, the way it's been implemented within Boston Children's, very early on, employees sought it out, started to make use of it. I thought it might be a handful of people. It's been hundreds, thousands. I had no idea that it would be this meaningful to frontline teams.
Question. What I would tell you is, based on what I know about the volume of activity that the Ombuds Office has seen, exceeding expectations and even predictions of how many cases that would be through the Ombuds Office, is that I know that Jen and team, hi Jen, have done a fantastic job doing things like sending people to the right place for further conversations, intervening before something became a bigger issue, giving people individual advice how to handle challenging situations, either with a superior, with a colleague, or someone who reports to them, or someone across another department, helping people deal with situations perhaps earlier than they would have been otherwise. So in many ways, it's preventive. The Ombuds Office, but it also does more than that. So what I feel is that we have somebody or a group of people who can get involved at the right time and do it in an extremely confidential manner, and and in a trustworthy way to help our teams. And it's every level of the organization. It's to every person in the enterprise has access to this service, and I believe that people are starting to use it even more and more and more, because it's proven to be a trustworthy, effective way of communicating, getting some advice, and talking about challenges.
I was actually a little hesitant. My experience with Ombuds hasn't always been terrific from years past. And as I got to know the services our Ombuds Office provides and the level of professional delivery, really assuaged any concern that I had. As I think about the work that happens in that office, I'm grateful that there's a space for people to go that is objective, that's confidential, that gives people an opportunity to share their concerns without it turning into something bigger than it needs to be, or creates an opportunity to turn it into something bigger than the person thinks it might be. So I've really had a great experience myself learning through our Ombuds Office, and more importantly, I think it's been a real benefit to the organization.
Well, I think it's hard to provide you with a quantitative number that says we did this and this was the output. But there is no doubt there's a tangible qualitative benefit. There is this sense that people have that they can go to a safe, trustworthy place where they will be listened to, where they will be given support, where they won't be judged. They'll be provided with potential tools to help them sort through the pathway they need to find or to go through to sort out their problems or whatever been confronting them. And really importantly, a safe place where they can be listened to and convey their concerns. And so we've seen that impact just by the volume of people and the teams of people that go to the Ombuds Office, to the point where we have two ombudspersons. And both Jen and Mike are just brilliant. So that's been very effective. I think it's also been effective from an administration's point of view. As an EVP of Health Affairs, I meet with Jen regularly. We don't talk about individuals, we don't talk about their teams, we don't talk about specific problems, but she does bring to me themes. She says, this is what I'm hearing, and this is something you should be perhaps thinking a little bit about, or what can you tell me that you have been doing for this particular circumstance or problem so that I can convey that back to people as well. It's been this really important dialogue that has just been so impactful.
So I think we're starting to focus on pattern recognition now. And while the confidentiality of the conversations is 100% maintained at all times, I think now we have the opportunity as leaders, and something that I hope to do is to hear the common threads and think about how do we use that data in order to change how we're interacting and supporting our frontline team members. There really are some themes, and they're in some cases they're consistent across the whole organization, and in some cases they're specific to the roles that people have in the organization. So I'm thinking about the implications for people who work 24/7, who do shift work, the folks who are in their very first job, and we've hired over 1,000 new nurses in the last 2 years at Boston Children's. This is their first time ever having a full-time role. They're doing it at a time where developmentally many of them are right out of college, and they don't have experience with knowing how to solve problems all the time. And to now have this safe space, and those are the two words that I think of most directly when I think about the Ombuds program. There's a safe space for people to come and say, I'm confused, something doesn't feel good, I don't know what to do, and to actually help to define a path forward with the Ombuds office.
It used to be that those issues didn't penetrate the four walls of the hospital. Right? You'd come to the hospital and you would deal directly with what's happening here, and what's happening on the outside was not as a stressor. But that's just not the case anymore. What is happening outside in terms of the anxiety that's being produced in our society, financial, emotional, educational, are being directly brought in. And before our program, we didn't have a resource or a plan of action. But creating and developing this program, the Ombuds program, has created an avenue, a venue for our people to be able to get not just a listening ear, but support about how to deal with these issues and direction about where else to go to help them.
Psychological safety across the organization for a long time, and we will continue to talk about it because it's very important. What I think the Ombuds office has done is help people think about, meet about these things in a professional, respectful way, in a way that is not offensive to anyone, to be able to use the right words, to be able to use the right approaches, to be able to understand the point of view of all those 18,000 people as best as possible across the organization, and have important conversations, but do them in a manner that's respectful and professional.
The important thing there is to discuss the tough conversations. And I'm not going to go through all of those particular discussions, you just listed them, and there are many more. The thing is, we have 18,000 people working at Boston Children's, but they're all individuals, they're not cookie cutter, and they're incredibly diverse, and that diversity we embrace. But with that comes their diversity of thought and culture and how they feel, and that's also important to embrace. So the Ombuds office has enabled us to not shy away from tough questions, because it is that safe place for diverse opinions and ideas to be heard, respected, listened to, frameworks to be established. And we are starting to move forward, I think, in a much better way to appreciate that there are societal issues that impact our workforce, and therefore how they feel, and therefore how they can work within our environment and our culture. And so we are very mindful of using the Ombuds office to help us address, meet the concerns expressed to us. Ombuds office are not telling us what to do. They're not there to say, you have to do this, say that. They're impartial, but they're providing a really safe environment that enables a dialogue. And that's really valuable.
So a lot of things keep me up at night. and you know, a lot of it is the day-to-day. We're in the throes of great transformation, both as a healthcare organization, as an HR organization, as an institution broadly. I know that there's a lot out there I don't know, and one of the things our Ombuds office provides is feedback that says directionally we're going the right way, or directionally we need to make a change. And I have comfort knowing that the way the information is aggregated and shared both protects the anonymity of the visitors to the Ombuds office, as well as gives me feedback in a really holistic and protected way that says, you know, you've got to do this, or you need more programming over here, or there's a policy issue over there, or there's a concern, and it gives us the opportunity to make sure we're focused in the right way.
Well, as we talk about psychological safety, as we talk about engagement, as we talk about our campus growing, all of our different locations, you know, a significant number of managers and supervisors, and all of the activity that happens here at BCH that makes us great and differentiates us in many, many different ways. Knowing that it's so complicated, it's so complex, though sometimes that keeps me up at night. And knowing, among other things, like budgets and buildings, etc. But knowing there's a really safe place, and I can tell you it is extremely safe. The Ombuds team is extremely discreet and doesn't share information with me, you know, where they report, and to Peter where they report. And so they're very confidential. Knowing there's a really good place to go to work on those complexities and communication and decision making and those kinds of things makes a difference to me. I think it's a game changer. You know, a lot of hospitals don't have their own ombuds. They're very prevalent on academic campuses and universities, etc. Us having one is different than a lot of our brother and sister children's hospitals across the country. So for me, it brings, it's not just a game changer, but it's a very respectful way of dealing with potential situations in our organization.
I'm going to say safe dialogue.
I would say safe space.
Essential. Absolutely essential.
Extraordinary.